What's up, guys? Welcome to the What's True Health podcast. On today's episode, we have Matthew Stamatas. Hopefully, I pronounced that correctly.
You did.
If not, he can. Okay, perfect. And he's a physio based out in Adelaide, which means you're our first interstate guest on the pod. So,
That's,
welcome, Matthew.
thank you. Thank you for having me, Victor. Yeah, it's a privilege to be able to talk to you. I've listened to a few of your pods, so yeah, I'm pretty excited with what you're doing in the space, man. Like, it's good to see, even in first year, like into your second, starting to just crack into the space. It's really good. So yeah, very
Yeah,
good to see. So thank
thank
you
you.
for having me on.
I appreciate it anytime. And well, I guess enough about me. Let's start with a bit of an introduction about yourself. Tell us
Yep.
a bit about yourself, your uni life, how you got into physio, why you wanted to be a physio, just a bit
Yep.
about that.
Yeah. So I'm into my fifth year of clinical practice now, primarily work in musculoskeletal private practice with people in pain. So that's my primary role ever since I graduated. I went through the university system pretty slowly, to be honest. So I graduated from school. I went on to do my first year in a Bachelor of Human Movement. Um, because I didn't get the required ATAR for physio, I felt like just short. So I spent a year in human movement, sort of kicked around there and worked my way through getting a GPA that was probably way too high, like studied way too hard, and jumped across to physio because I was always sort of had the blinkers on for that. It was always my intention. I wasn't really looking at anything else. And then went through first year, second year. In those years, sort of got into the space of doing like semi-elite rowing and decided that in my third year, I wasn't really going to manage doing uni and sport. So part-time to see what I could get out of rowing. Got reasonably okay at it, reasonably good, and then didn't make it to where I wanted to. So back to uni fourth year and graduated. And that took me a total of 6 years to get through my physio degree, which felt bad at the time. Like I wouldn't really change that now. I sort of look at how I would have come out of uni if I'd just gone 4 years through as a like probably a 20 or 21-year-old at that point, and I think I wouldn't have been ready. Not that you're ever ready, but like it's a lot younger, and I feel like for me in that time, I probably wouldn't have been ready. So yeah, it was good to take it slowly and have a different sort of path through. Yeah.
Awesome. Yeah, that's really interesting. So it's a bit unconventional, like halfway through doing the part-time, yeah, with rowing. That's interesting. So, but at least yeah, you tried it out. You see if you saw if it was for you. Like you wouldn't regret it down the line not having pursued your rowing career if that was on the table.
Yeah, that was it. I sort of went. There's probably more of a time limit on the rowing. Is like you turn sort of 22, and they're sort of looking at you going, "Are you going to make it to an Australian team?" And if you're not, you're sort of out the door. And I ended up out the door, but like you got to sort of go all in if you want to find out. So that's what I sort of did. So yeah,
Definitely. That's
yeah,
really interesting. Yeah. And then yeah, you mentioned that having that extra time actually helped you in your new grad years. Tell me about that. That's quite interesting.
yeah. I think just having a little bit more generalized life experience in both in sport and in life, and just having having a look at maybe high performance sport as an athlete probably changed my trajectory in terms of what I wanted to do when I left university. I sort of went in with this whole, I really want to be a sports physio. I really want to be like the best sports physio there is. And I'm going to work with the Crows and AFL teams and like everyone sort of, you hear that a lot in Adelaide, especially. And being within that sort of high level sport, like I just sort of went, I actually don't enjoy some of the, for lack of a better word, vibes and atmosphere around it. And some of the things that go on there in terms of how physio is delivered. It didn't gel with me, and I probably couldn't quite describe why at the time how I can now, but it came down to like it's probably through a more biomechanical lens and like centers around shorter term strategies, which didn't sit with me. But again, it's just a different context to what I work in now, and I felt like that context wasn't really where my passion lay. So that's probably where it changed how I would have, it sort of shaped how I wanted to leave uni. I didn't want to do some of that stuff as much by that point. So I think it helped having a bit more experience under my belt there. And yeah, just being a little bit older, I think as for me as well, as you get older, you just meet different people and learn a bit more about the world, and probably made me a bit more empathetic and sympathetic to people, like understanding a bit more. I mean, you can be like pretty rubbish as a 20-year-old sometimes. So like, I think just having met a few more people in different circumstances to myself helps. So yeah, just
Okay.
time. So,
Yeah, so key points I'm hearing are like with more time, you got, I guess, more, you sort of like grew up, you built more sympathy, like compassion, empathy.
yeah,
So those sort of things, which yeah, obviously they're really important as a allied health professional in general. And yeah, I see that as well. I compare myself to when I was like 15 or 16. I'm like, oh, that guy's probably a little bit immature. I'm
yeah,
probably still am a little bit immature, but it's getting better.
yeah.
But
And you
okay,
learn. Yeah.
it's interesting to think about it that way. Yeah. And the other thing that was interesting to me was, yeah, so you were actually in the sports physio space, but you didn't like it that much. I would imagine it's very like sh like short-term solutions, like we got to get this player back on the field, sort of thing. And
Yeah.
and I feel like it's very com this is all speculation from mine, but this is what I've been hearing. It's very competitive as well because if you're not performing, there's probably 10 other physios who want your position that could replace you. Is that true?
Yeah, I would say so. I probably haven't dabbled in that space as much. I think, like, to give you a full opinion on whether it's competitive based or outcomes based, I'd actually argue from the perspective I have looking in, it's probably there's a lot of who you know. There's a lot of also just ex-athletes in the space. So you did the sport, you're the physio for the sport because you did the degree. Like it's not necessarily like how I find it really hard to quantify how good is a physio, like comparative to one another. That's probably something that growing up throughout physio, I was like, oh, actually, different people are just for different people, like in different contexts. Like one's not better, you might be better suited, but comparing them is hard. It really it is a short, like to me it was like a lot of short term, like you get a sore back while you're rowing, you get out the boat, you complain about it, they send you to the physio, he does dry needling on your back, you maybe get one or two exercises and you'd sort of do them or you don't. If you're like athletes probably sometimes don't, and things recur and you're back there. It's like it was very cyclic like that. Like I remember the treatment I got was pretty well. You get the dry needling, you get some exercises that are framed up as like, oh, your hamstrings aren't long enough, your back's not tolerating the load, like what you're doing because your hamstrings are just so short. Like very narrative around the biomechanics and how that's failing you and you're not doing enough to change it. And here's a passive modality to go along with it. So, and that vicious cycle. So I look back at rowing and was like, if I spent so much time stretching. I'm like, if I spent less time stretching and could have had a better understanding around my load tolerance or how to manage other aspects of like sleep, nutrition, other things that might have been playing a role in how I was rowing or how I was feeling, like how much more powerful that would have been to me as an athlete, instead of just being like, oh, my hamstrings are short and tight, therefore back pain. Like that's sort of why I was like, this space doesn't work for me.
Yeah. And imagine imagine you're a rower and like if you're a competitive rower, that's your career, right? So it's everything, you've invested everything into this. And then to be told your pain is due to a tight muscle or something like that, or like that's going to impact you really heavily. And I feel
Yeah,
like, yeah, it could impact you a lot. So obviously, yeah, stretching all day or like for a long time, like it makes sense because yeah, I don't want to get my back flared up again.
yeah,
So it's totally understandable, but yeah, it's just crazy that those narratives are still perpetuated even in elite sports.
yeah. That's it. It's like, how confident can you be that that's truly causative? Like, one, this hamstring leads to the back pain. Like, could that narrative be more like, here is something that could just help you manage this in the meantime? Like, that
Mhm.
probably a nicer way to say that instead of it being a failing of the athlete or a failing of their body or something that fundamentally doesn't change necessarily. Like, no matter how much I stretch this, it's still not working for me. Like, why? Those sorts of questions come up to me as an athlete. And that was where a lot of my frustrations lay as well, in that sort of space. So that's how, yeah, that influenced maybe my perception of being a sports physio and why I grew away from that. So, yeah,
Wow.
there's other aspects as well. But yeah. So,
Yeah, thanks for that. Yeah, I haven't met anyone in the sort of sports or like elite sports sector. So like even the fact that you've dabbled in it for a little bit, like it's interesting to learn from you.
yeah.
And I definitely learned a lot from that, just like 5 minutes of conversation. But now
Yeah.
we obviously steered away from elite sports and now you're in private practice, right?
Yeah. Yeah. Yeah.
And what sort of populations are you seeing? Like, is it, if
Yeah.
you can ask what sort of things?
Um, I'll go through from like, so I've been in three different practices. I'm at
Okay.
the third. I'll just kind of go through because it has changed a little bit. Sort of in my first practice, it was like general musculoskeletal stuff. So like people walk in, I've got a sore back from the weekend, or you get really everything. It's like it would be, my shoulder's been hurting for months. Like, what do I do? Back pain, return to work stuff like compensable schemes, home visits for like hospital in the home stuff. Like, I've had a total knee replacement, 6 weeks of physio in the home for that knee replacement. So I had lots of different exposures to a bunch of stuff through that first job. Second job, I had sort of very similar stuff, probably more truly private practice, like privately paying patients, sorry, less compensable schemes. And I had a little bit of stuff within aged care within that job as well, which was a bit different. And that there was also more sports at that clinic. So that was a bit more focused in on like, you'd be going and doing weekend work, covering sports games, or so like your Friday night might be going out and covering sports games as a physio to build your list to bring those guys back to the clinic. And so there's a lot of unpaid hours doing that sort of stuff as well, to try and develop that. So now I see probably less of the like typical walk in, my back hurts type people coming in. I see a lot of people with neurological conditions now or under the NDIS scheme, some return to work as well. And the guys I do see who come in as a more privately funded patient are people who have tried physio for a long time or like are not getting anywhere, and they're like, what do I do with myself? And generally that comes from people being like, Matt approaches things a little bit differently to like other physios, like not to like, degrade that or anything, but it's like I steer away from some of that stuff and I try to do things a bit differently to what they might have experienced before, so offer something different. So I get a lot of people looking for second opinions about what they can do with themselves. So
Yeah,
yeah, that's sort of where I work now. So
yeah, that I can't imagine like a harder job than someone who's had bad experiences with physios coming to you and being like, I've done all this, it hasn't helped. Like, what do I do? Like, how do you even
Yep.
approach that?
Um, a lot to start with. A lot of it is I let people tell me their whole experience from start to back, and it's like, what has your experience been with A, whatever's going on, like your pain, your injury, and B, what has helped and what hasn't helped. So I spend a lot of time examining with that person maybe what has been useful for them and what has been not useful, and maybe why. Um, and just letting them tell their full story. I think a lot, and this is something that I've had to learn as well, is like a lot of the time people don't get an opportunity to actually tell their story and feel heard and feel validated. So I spend a lot of time just listening and trying to connect with the person, like on that initial consult, to understand where they're coming from. And then from there, it's about trying to find what they, I guess, meaning is probably hard to find it. So what are the things that are missing? What doors are closed down to you, and how do we work towards opening those doors? And I feel like a lot of people have the answer already. They sort of know the things that they could be doing, but they either need permission or someone sort of facilitating it to help them get there. I say need, they might want, but it might be hard for them to initiate that themselves, or they might not understand that it is okay to be doing those things. And often it's about helping them navigate the path back to those things. So it's a lot about figuring out where they're at, why they're there, helping them critically reflect on their situation, and then sort of being almost a coach to help them do things again. So today I spent a long time with a really lovely lady who one of her big goals has been just like returning to gym work after some really like bizarre and interesting metabolic stuff that's been going on with her. So it's like not even really musculoskeletal, but there's heaps of functional loss in how she goes about getting to the gym, her range of motion. It's just about like, what are the tasks? How do we break them down? She wants to be able to get up off the floor on her own. How do we break that down and just train that and retrain and build experience and confidence in those movements again? So that's kind of the philosophy I work on. If someone can get an experience and get experienced enough with a movement, they can return there, provided they're safe to do so. So, yeah.
Yeah, awesome. So what I'm like summary, well, from what I've heard is
Sorry, it was a lot of words. Like,
right?
I do tend to ramble. So,
No, that's all right. Um,
yeah.
yeah, so what I'm hearing is like listening to the patient, empathizing with them, listening to their story, and then from that you can pick their like parts which may have helped them in the past or things that may not have helped them, and then sort of starting from that, maybe the best option to go, and then like seeing what their goals are and any movements that they want to get back to,
Yep.
and sort of breaking those down into like manageable chunks and then slowly working our way back up.
Yep. Yeah. Which sounds really, really simple. And I think it is really, really simple. If I was to put that into like really simplified terms, it's like zoom way out and just go, how can I help this person more broadly? Like I would say like I don't focus too much on provided it's safe again, qualification. Provided it's safe, I won't spend too much time laboring over the pathoanatomical stuff that's going on unless I am concerned about red flags, progressive pathology, or there's something that's not adding up that I'm just curious as to how that might influence the direction of my management. Like that's if they're safe and reasonable to move and I'm keeping an eye on how that's progressing, then it's a zoom out and work on that whole person and picture rather than being like you are your torn rotator cuff or you are this metabolic syndrome. Like I try to take that away from it because I think people can feel quite like, oh, I've been to physio and they were just treating my issue and nothing changed, or like they don't view themselves as a person capable of change. They're like, my condition is this, I'm stuck. Like, if that makes sense. Yeah.
So do you like when you talk to patients, do you say like you have this diagnosis, or do you try to say it a different way or not say it at all?
in this job, it depends. So it depends on the context there, because a lot of the times I have people come in and they tell me their diagnosis. They're like, this is what I've been seeing someone for, and this is what the doctors say. And I'm like, that's cool. And we maybe talk a little bit around what I say is cool. I'd say, like, let's talk a little bit around that and what that means to you. Like, what's your understanding? What has eventuated from this? What's your experiences with it? And if someone has come in and they're not sure what's going on, I still generally will provide someone with a diagnosis of sorts. So it depends on how confident I can be in what it is, and often that's not very confident, because and I explain why. It's a lot of the tests we do as physios don't have that sort of diagnostic power we like to think that they do. So I will give them more of like I think Dave Moen refers to it as like a constructive diagnosis, where it's like, it's non-specific low back pain or back pain. We can't really say what from, but here are the things we can do about it, rather than being like it's a disc, or because I just can't be confident. So I give more broad picture diagnoses, which are then like, you are still safe to do stuff within this pain, and here's why. So I'll walk people through the diagnosis generally, like, here is why I asked you XYZ questions. I'm looking for these things and they're not there. So we can rule this out. So, yeah.
Awesome. I love the way you reframe it. So, like, because the problem is if you provide no diagnosis, it's like, what am I here for? Like, then they need that little bit of guidance. So you're providing them that comfort and that sense of certainty, while also not limiting them with that diagnosis. So that's great.
Yeah. So instead of being like, as you said, it's like not limiting someone to just their diagnosis. It's like, okay, well, this is what could be happening. We're not sure. Let's try to move in a good direction that we can. If we're comfortable and confident in that you can move, then let's move in this direction. Yeah. Sorry, I'm just waving by to in the background. Yeah.
Awesome. So winding back to all the way to your first job. I don't know if you remember much. I can't remember a couple of years ago what my thoughts were, but try and recall, like, as best you can, what was it like at your first job? What were some of your thoughts going through your mind, and like, how was it? Did you have that typical imposter syndrome? Talk us a little bit through that.
Yeah, I don't know if the imposter syndrome ever really leaves you. Like, some days I go and feeling like I'm like, I'm switched on. I really know what I'm talking about. I'm good in this role. I'm helping people, and other days I'm like, shit, what do I do? Like, I just can't even define it sometimes, and it feels a bit nebulous. And so that, I don't think that imposter syndrome necessarily leaves. It comes and goes, and you learn to sort of just ride that a bit. In terms of how I felt about my first job, or how I felt going into it, I think I was like pretty, still pretty voracious for knowledge, and like still probably in that really, I want to be able to diagnose pathoanatomically. I want to fix people. Like, if it's a rotator cuff injury, I want to know exactly what muscles and exactly what exercise to apply to that person, and that's going to get them better. Very knowledge driven, without probably the frameworks to apply it in a way that makes sense to me now, and pretty reductive in my reasoning, I would say, like just narrow focused, and I don't think that helps that many people. So knowledge driven, reductive, and probably not critically appraising myself. The other word I'd use is like super uncomfortable, and the reason being is like my own personal experiences with, so I should qualify that statement. So when I left uni, I had an injury that was a bit strange and unexplainable. And my process through seeing physios for that injury made me like really question what people were doing, but I didn't have the critical reasoning to like look at them and go, I like, why are you treating me in this way? Why aren't you sending me for this? Like, I didn't have, and like, I felt very lost in the physio system. And then when I got out, I found I was probably doing those things to people. Like, I was not looking at their whole picture or what they wanted to do, and just being the physio I didn't like having seen, if that sort of makes sense. So I was being the thing I didn't want to be and pretty uncomfortable with it, but I didn't know how not to be that thing because that was what I was taught. So,
Yeah, it's interesting how that your pain experience actually led you to become a better physio
yeah,
by self-reflecting. So I guess it was beneficial in a way.
yeah, it was. I think, like, on reflection now, I think the reason it changed a lot of my views and made me so critical of the profession was, as a person in pain at the time, like a lot of pain and a lot of dysfunction, I was sort of like, why is no one helping me get back to the things I want to do? Like, all I felt like was that I was a problem to be examined, and like trying to find a root cause and exactly like how to fix that exact problem. And I felt limited because I had limited diagnosis. So it was like, it is this specific muscle and nerve, and therefore we can only do like internal rotation with a TheraBand. And if you go and do shoulder press with your dumbbells, you're like going to dislocate your shoulder. And it was like, and I was like, I just want to go back to the gym. Like, I'm missing that aspect of my life for my mental health. It just doesn't feel good. And then I was like, oh, I'm doing that to people. Like, and I don't know how to reconcile that in myself because I don't know any better. So it was that sort of experience to me. And then reflecting on that, I'm like, I don't want to do that to people. It feels rubbish. How do I help people get back to meaningful things, not just get out of pain? Pain might, working within pain and reducing pain, or might be an aspect of that to help them get there, but there are more constructive ways to do it. And I think I was on the receiving end of some really not helpful ways, and that's made me reflect a lot. So,
Wow.
yeah,
That's really powerful because people who go into physio, they're usually athletic or have some sort of sporting background. And it's, I guess we have less of those sort of debilitating injuries, I guess, if we're more active and
yeah,
we sort of step outside or like never experience the feeling of maybe what like one of our patients might feel. So having that experience is actually quite humbling to be able to put
yeah,
yourself in your patient's shoes and see. Yeah, it's a very weird experience. Like you're the patient now, and then you can reflect through a third person perspective.
yeah.
That's wow, that's really interesting. I've never thought about anything like that before.
Yeah.
Yeah, wow.
It made me appreciate, to a, like, obviously mine's to a lesser extent, but if you have something that really robs you of function, like you can't use an arm, it really makes me go, like, how that is when it's like more global, like how people would feel about their function when they've lost so much. Like, how do you engage with the community, the things that are meaningful for you, and how that affected me. I'm like, that's amplified in people. Like, gives you that appreciation, like you said. So a lot of physios I know do tend to come from having, like, their interest in it is spurred by having an injury. So like the same sort of shoulder problem happened to me when I was in like year maybe 8 or 9. I can't remember exactly which, but that started my process of being interested in the body and physio. And then it happened again, and that made me like have this weird cognitive dissonance around how I felt about physio versus how I felt as an individual in pain, not being able to reconcile that until a bit later on. And so it's like those experiences did sort of shape me towards where I am now. So yeah, certainly opens your eyes for people.
Wow. I think there's a lot to be learned there. And for the listeners watching or listening, yeah, like take notes. It's crazy. Yeah, you never think about these things, and yeah, I feel like it's a topic that most people don't even talk about, and it's an interesting way to critically reflect. So I guess if you're in a state of injury, I guess you could use that as a tool to
Yeah.
practice your reflective thinking. But I guess rewinding once again,
Yes.
what if you could go back to like new grad Matt,
Hmm.
what would you say to him, or what were some things you would recommend to really like speed up that process of like being up to something where you are now? What would be some of the things you wish you did?
Um, I feel like I got there fairly quickly. So I had that discomfort, and I was fortunate enough to two of my colleagues in the clinic with me were like very open-minded, pushing the boundaries of what they were like trying to learn and like exploring more expansively throughout the lens of a biopsychosocial approach. So they pretty quickly got me onto like the course that comes to mind and that I did was the knowledge exchange courses, like that Dan runs and Brendan Mott run, and that sort of tumbled into the rest of it. So I got there pretty quickly, but I think I would have liked, and I still probably would like to, I would like to be a better critical thinker, especially when I started working, like being able to examine my own thoughts, my own biases, how things work and why things work. I think just having a more skeptical brain, I think I was still very much a student who, when I need the right answer, there is a black and white, like this master does this, this test tells me this. Like it just, there wasn't enough examination of that whole process. So more critical thinking. I would have also liked to have probably been a bit more prepared for like how it feels to work in a clinic, which I think is a common theme amongst like people and listening to podcasts in like in this sort of space is like burnout's probably going to come or some form of burnout. Like it doesn't have to be like you're crashing and burning. Like it can be this slow, gradual like thing that comes and goes. But how to not remove yourself from it, but how to acknowledge it and cope and have better strategies around that. And I think you develop that over time, but probably being more open to accessing supports earlier. So I wouldn't necessarily talk to my co-workers in a productive way about it. I just whinge, which I don't think helps. Like so, being more open to talking about that stuff with my co-workers where appropriate, and then also like being able to approach like people within the same sort of brand space as me, like on the knowledge exchange groups, like and just lean on them for support, like use those communities to help not feel like such an alien working in a clinic that probably wasn't built for how I think or feel like it wasn't the direction that clinic was going. So, you know, you feel pretty isolated and you're probably not. So, but that's probably a reflection of me. Like I'd reach out for help. So that's probably the message.
Yeah,
Yeah. Yeah.
reaching out. It's yeah, because especially if it's your first job and or like so many unknown factors are happening and like you don't know where your brain's at. It's a new
Yeah.
experience and you don't know if what you're experiencing is normal or not. So
Mm.
reaching out to online communities like the Knowledge Exchange or reaching out to people like even me or you, Matt,
Yeah.
like it's good to know that there's other people that are with it like in that process or have had similar experiences to you. So
Yeah.
that could definitely be comforting and I could see that being very helpful.
Yeah. Yeah. It's just not feeling so isolated. And I guess being the first job I had, like as a professional, and it being full time, I was like, oh no, this is just how it's meant to feel. I'm meant to be working hard. I'm meant to be driven into the ground. That's probably the other thing maybe to touch on here is in a non super critical way. I wish I knew how to identify when a job wasn't necessarily for me, or maybe was like being a bit exploitative. Like, so just being able to recognize when that's occurring and when that's not okay, and how I feel about it, and then what I can do about it. So I think there are processes in businesses that aren't very helpful for new grads, and there are some that are, and it's being able to differentiate the two. So the one that comes to mind for me is like having mentoring, and mentoring can be many things, and I didn't find it so helpful to have mentoring that was centered around cancellations, rates, and billing rates, rather than like the mentoring being around like how to help people in certain situations. Like, there wasn't enough clinical mentoring. It was more focused on why aren't you turning over money, or why are people not coming back, which maybe can be helpful in some cases, but as a new grad, I felt just made me feel real bad. Like, so yeah, recognizing those things and why they make me uncomfortable and why that doesn't sit. So yeah.
What kind of mentoring is that? Just why are patients not rebooking? Why are they canceling? Like, I don't see a lot of benefit from that personally. Yeah, I don't know.
There's business benefit to it, I think, in examining that, and like, but a lot of that did center around making sure you're rebooking people that are sort of going, well, aren't I meant to be helping people like not need to be here? Like, why do they need 8 sessions? Like, that's the whole concept of like, it comes up a lot is like in clinics is patient visit average or PVA. Like, you're not doing your job well if your patient doesn't see you like 8 times. Like, that might be sort of taking that a bit out of context, but like that has been promoted in places from what I've seen. And I go, well, what if that person just needs like 1 or 2? Like, why can't I let them guide with me alongside them the journey? Why does it have to be like, you need this for every problem? Like, that makes me quite uncomfortable. So like, yeah, being able to identify how your values fit within the space you're working, and then if there's a dissonance, being able to be like, well, do I move on or do I reconcile them, or how do you go about that? So that's probably something I would have liked to have been able to do earlier.
Yeah, I hate the fact of judging if you're a good physio or a bad physio based on how many people you're seeing or how much value you provide to the business. First of all, you can't even define a good and bad physio, but like even putting it in such a reductionistic way, like capitalistic way as well. It's just like it's kind of laughable, but people take it seriously, I guess. I mean, if it's your business.
Yeah, they do. And I can understand why. It's like, I think it's very valid to say, yes, we're running a business and like there needs to be revenue made. Like, but I think the systems that have been in place from earlier physios that are still running now, I don't think those systems hold up in a modern healthcare space with a modern understanding of pain and musculoskeletal health. I think those systems are failing us. So like, one thing that comes to mind from my second job was having 20-minute appointments with people. And I'm like, I don't think that's enough time for me to adequately explore what's going on with that person and provide them with the service I'm comfortable with. It might be enough in some contexts and some clinics to be like, yeah, 20 minutes, needles, provide some brief education outdoor and like pump them through, because the business structure is predicated on turnover of 20-minute appointments. So if you expand it out to 30 minutes or an hour, like, how do you make ends meet? So I sort of look at it as the failings of older systems having to adapt to new changes. It just hasn't moved there yet. So I understand where the business pressure comes from, but I don't think it's like excusable to some degree. It's just like, here's maybe the reasons, like, how do we change them? So
yeah, I think you highlighted something very important there. Like, people often talk about the research to practice gap, how that's massive, and people are still doing outdated practices and not in line with the evidence. But no one really talks about the practice business gap, which that's really interesting. So yeah, while our practice might be at a certain point, our businesses might be 50 years behind. And
Yep.
it's really interesting to think about how we can update those to close the
Yep.
gap a little bit on that. So
Yeah.
yeah,
Yeah.
that's a whole other can of worms. And
Yeah. It's like you've got a set of constraints for a business to work within, and how do you make the evidence and the guidelines fit those constraints with those individual workers and people? I guess it's like you look at how do you even implement guideline-based practice, and it's like that's super hard. Like it probably isn't feasible in every situation. Like here's the evidence, the gold standard stuff, or maybe the slightly murky stuff that we sort of know. We go to apply it, and you can't just apply it like directly. It just doesn't work. So like the context of that person, the context of the business that is being run, the context of you as an individual practitioner, it all matters, and it all shapes how you interact in those systems. So there's you're right. There's this big gap between like evidence and business and practice. Like yeah, if you're in a business that has certain constraints, it's hard to implement practice you want to do. So that was probably the motivator for me to find my third practice where I am now. That movement in mind was I was like, I don't feel like I can do or provide physiotherapy services that I feel I want to provide that align with my value system. Like I was like, I need to find a place where I can do that, and I can do that maybe not comfortably, that's not the right word, but I can explore that comfortably with the others around me. So I work with 3 EPs, and I'm the only physio, and we're all very much of the same sort of value set and like trying to work towards a more biopsychosocial lens of practice without having sort of a churn and burn clinic, I guess. So I felt like I needed to remove myself from those constraints of that business, find somewhere a little bit more aligned to my values. And that's hard. Like it is very difficult. So, but I think I've found that. So, yeah.
Yeah, that's great that you found your place in the third clinic where you got, as you mentioned, 3 EPs, was it? And you're working together to find that balance between losing money and
Yeah.
providing the best care.
Yeah.
And that leads me on to the other question, which is, what have your experiences been with other allied health professionals like EPs, you mentioned chiros, osteos? Have you referred to other people much? Like, describe that experience.
Um, yeah. So in my first job, I didn't really work with anyone but physios. To be honest, we had like massage therapists, and kind of the process there was like you had a management plan that you'd print off the patient at the end of every initial consult, and you might sort of check a box that says they might be suitable for cross referral to massage, which because they have pain, but also I'm supposed to be supplying the manual therapy, so why do they need additional manual? Like, it doesn't make much sense, but like it was kind of like physios up here, massage next level to do a longer bout of manual therapy, bit of a physio echo chamber, and that we're top dogs. No real outside allied health from them. So second clinic, I did a bit of work with OTs, especially within the aged care side of that job. So that was quite interesting to me. There's one OT in particular who she was really good at just examining a person's and talking to people and just examining like how they're coping with their situation, their function, and giving them supports that they needed. And that was insightful for me to see someone approach that maybe a bit differently with like more adaptive technology or more assistive devices, and it's helping that person engage like with the world. Like she was very much looking from how do I optimize this person's function with some description of tool or guidance, and then helping them get like she was very much in that lens of biopsychosocial practice, and that was really interesting to see, because I'm still to this day a little bit confused about what the roles of OTs are. I think there are lots, so I find that quite a hard profession to not pin down, but understand. And then working with EPs now, I think I'm probably more aligned towards an EP model of practice, if you want to call it that, where it's more about, or I feel like my model of practice is exploring movement, behavior change, examination of belief systems, and trying to implement practical steps to get back to that person's goal. Whereas in my previous second clinic, EP was sort of like, oh, they're just there to manage the chronic conditions. They're there to run classes that are based around those chronic conditions. So again, it was like physio first, EP second. Like there's that hierarchy that I know you've spoken about in other podcasts as well. Like it exists, it's there. Even within I'm sure you would have seen it, like when the APA released that sort of statement, and like I won't delve into that too much, but it doesn't sit well, like with me. It's just such a weird situation at the moment where I think what you spoke about with Dan, where it's like professions are probably going to just diverge more and more rather than actually come together. I think it's rooted in old school thoughts and narratives, and then really wanting to make sure that we have our, the APA, that we have our patients, you have your patients, don't encroach on my space. Whereas I think a more collaborative approach to MSK is what's warranted and needed. Because people are confused in society, they don't know really, and it's just getting harder and harder to explain sometimes. So yeah, that's been my total experience. The only other health professional I regularly interact with are probably GPs or sports doctors, and that's more through your sort of Medicare-based referrals and talking to them about people, or with the sports side of it, or not even just the sports side of it. Sometimes I'll refer, it's more referring on when I'm a little bit I want to make sure this person's definitely safe. So if I'm seeing something that I don't think is necessarily musculoskeletal and might stop me, or might be I need to hit pause and let's just see if we're safe to move, I'll refer on and just have conversations with them, which is super helpful. There's been a few situations where you just see some really bizarre stuff, and it's nice to have a doctor around. So stuff that comes to mind are seizures, having someone where you're being described what's happening to them at home, and then they come in and no one's really sure, and you're just sort of sitting there going, they having seizures and no one's picking up on this, and then you send them off and it's yes, they're having seizures. So that sort of stuff does pop up, cancers pop up occasionally. So being across that sort of your red flaggy presentations is pretty important, and just having a GP around or doctors to talk to, that's been very valuable. So yeah,
I can imagine having having that certainty of a doctor or a GP around, if you said, if there's seizures or something you're not 100% sure with, and you want to know they're safe to exercise, refer to the GP. Yeah, is that something you get taught, or is it just?
I not well enough. I think the concept of red flags is explained in the course, and you have an awareness of it, but I don't think you really learn. I don't think you learn it to the point where you can go, I need to refer on. And I think it really is a gut feel. I think that's what the evidence sort of points to as well. It's not, maybe 5 red flags gives me a little bit more confidence that something maybe is amiss, but it still might not be. One thing might be enough. Why is your shoulder exercise, why is that making you super short of breath? That's the only thing that's a bit weird about it. And is that something to do with the lung that's more systemic? And that's the only sign. I don't think it was particularly well taught, in my opinion. I don't know if that's me being a bad student though. So hard to say. So yeah, there's other ones where it's, one that comes to mind with a red flag is just a a guy I saw in my first year presenting with neck pain. I really couldn't define why it felt off. Like I could have very easily just gone, I'm going to treat it, and like just, like I'm going to treat it like neck pain. I'm going to treat it like a disc or a PIV, which I would have been thinking at the time, and just off he goes. But like stuff didn't feel right about it. And it was really hard to put into words at the time when I spoke to another colleague about it. And I did end up treating his neck, and he felt a little bit better. Like we went, well, let's treat it, see what happens. And then I actually gave him a call the next day, and because I was just like, it just seemed so weird, so off. And that guy had meningitis. That was why he had like neck pain. So like, it wasn't anything really to do with like a musculoskeletal problem. It was like he needed to go to hospital, and he was in hospital when I rang him. Actually, like overnight, he had just gone, no, this is weird. And it just, the gut feel, like, how do you teach that other than experiential learning, I guess? So yeah, and just having a broad knowledge base, like just reading up on how things might present, or having a broad understanding of like your anatomy and physiology. Like they're not things you throw away, they're just things you might frame up differently as you move along. So
Wow, that gut feel is it's like a superpower, isn't it?
yeah.
You couldn't pinpoint anything, and just you thought
You
something.
just get a nick and you're like, nah, I don't want to deal with it. Someone else can. Like,
Yeah,
so,
it's very interesting, that phenomenon. Yeah, because I mean, if I guess if you've been taught a certain way, like how, or like you've had experience with a way something presents, something a little bit off could trigger that maybe.
yeah, and like sometimes you might put it to the side and just watch it. So you might just go, I'm not totally convinced this is in danger territory, but I'm just going to observe it. And it's something, particularly for me, like I'm probably more hypersensitive than most of this stuff. I'm like constantly like, is something going awry in the background? Like just being vigilant, because stuff does evolve as well. Like things can hide. I would probably put that down to within myself again, like experiential learning with my shoulder. Like when I was even like 14, I was like, no, this isn't normal. This is weird. And it was weird. And then when I was older, I was like, still weird. And I have a physio brain now. Like, why can't I figure this out, like this problem, when it really wasn't something physio should have been dealing with? So that's why I'm a bit more attuned to it. I'm like, I got ignored when I was like, could this be something else? And I was pretty bluntly asking that question. I didn't know. And when you're in pain, you're not the best judge of like critical reasoning anyway. So it's you just broad knowledge. Yeah, stuff like that. You will, hard to explain. So
Definitely. Yeah.
Yeah.
I didn't know much about like red flags and that sort of superpower that we're talking about. I didn't know much about it. I knew it, always knew it was a thing, but yeah, I didn't know like all these things you explained about it, how like it could get serious sometimes. Like you
Yeah.
could lose cancers, meningitis, and
Yeah.
it's yeah, you never think about, oh, I want to be a physio. You never think about that part of the role. It's
Yeah. Yes. Yeah. Well, I guess that's actually like I wasn't really thinking about that part of the role, and probably the thing that I guess made me think about it more, and like probably framed up a lot of how I practice in general, was reading the book Permission to Move, which is one of Dave Mullen's work. Like reading that and just having a bit more of a framework around like clearing that stuff and why. So that's probably the bit that was missing from uni. They were like, here are all your red flags. Okay, you know them, great. Can you list them off? Great. But then putting them into context of like, here is why this sign, what it might mean, and why that is important. Like, and why that's where diagnosis is like probably more important. Is like, are you missing something serious or sinister? Is it going to change the direction of your management? So not even just red flags. It's like, is there just something more systemic going on? Like, is that a reason for why this is going the way it is? Is that something that might need a medication? Like, so just being curious and being thorough and understanding why. if I could distill what was missing for me from uni, it was understanding why. I felt like I did a ton of rote learning, and then there was always missing like context and why. So here are a bunch of conditions. Here's the signs and symptoms. Okay, go. Like, can you list them off to me? Yeah, that's probably the more reasoning and why things are the way they
are. Awesome. Thank you so much for that. That was amazing. And you mentioned a book, was it? Permission to Move?
Yeah, Permission to Move. Dave Moen wrote it. I think Lorimer was also author. I feel like I know it as Dave's book, sorry, but I'm just looking it up in the background now. But yeah, Permission to Move is a book, and it's like a clinical book, so like for clinicians, but it's also like Dave made it as like a course or something that clients or patients can use, like a resource, and that has since changed and evolved in Dave's practice from what I know. But I think as a framework for me early days, that was very valuable. So it's worth a read, definitely.
Wow, I'm definitely going to be looking into that. If you have any other sort of resources that have helped you, feel free. I'm giving you the space right now.
Yeah, you're already accessing a lot of them. So like you've got Dan, who's like the ultimate resource. Like that man's brain just knows everything, or has like, you ask him a question, he'll be like, here's like 4 things that you could look at, and I'm like, it's kind of overwhelming sometimes, but I'm always very impressed, and it's always super helpful. So like he is the knowledge exchange community, like their courses as well. Even just, I think Dan posted not too long ago, like Instagram handles of people that are good to follow, just who are like of a similar brain space. So like just having people whose opinions you go to and you're like, I trust that. Another course that really shaped me as a physio early days was Jared Powell's The Complete Shoulder course that he runs. I did that online because it was like during COVID. I started being a physio in COVID as well. That's the whole thing. But that was a really good course in terms of I really liked the anatomy and stuff around the shoulder. That helped me reframe a bit of how I might practice in terms of a more biopsychosocial lens rather than just being like, rotator cuff, supraspinatus, do this. Like it was a very helpful course for me. So yeah, that'll differ from EP to Physio maybe. So yeah.
Wow, thank you so much for that. And yeah, I'll definitely look into the course, shoulder physio course, and the book Permission to Move. Sorry. Yeah. Thanks for that. That's really good. If any listeners or people watching want to find you, where can they find you?
I have a like physio Instagram account. A bit lame. Sometimes I feel like it's a bit lame. It's called Move Resilient Map. Just that's probably my big interaction with social media that you sort of, one of the talking points we might speak about, but like, it's just a way of trying to disseminate good information. So like it came about from me being frustrated that there's so much bad information. It's like, okay, instead of just being angry, like put something good out into the world that might be helpful. So, and that's probably my entire experience with it. So Move Resilient, and that is my Instagram. So yeah.
Awesome. Well, thank you so much for coming on, Matt. I really appreciate it. Lots of knowledge, lots of experience that I could have I got knowledge from today. Thank you so much for coming on, and hopefully we'll see you again.
Yeah, man. Yeah. If anything like comes up that you have questions about, like happy to clarify. I do tend to ramble and taper off a little bit. So, like if any of it's unclear, like do ask. Happy to chat about it. And thank you for having me on. Like, yeah, really enjoyable to chat through things and just speak with people on the same wavelength. So, and like, as I said at the start, super impressive that you're already sort of doing this, like, and really nice to see that it is coming through early on for people. So like, I would have loved to have been in this scenario first year, like having that critical brain and looking at articles and thinking and meeting people in a like mind, like so good to see. It gives me a bit of hope for the profession. generation, if you want to put it that way. Yeah. So things are changing, hopefully. So yeah.
Thank you for the
Thanks
kind
so much.
words.
Yeah. No,
Well,
all good. All good.
well,
All
thank
right.
you so much, Dan. I mean,
Yeah.
sorry, Matt.
Yeah. No, all good.
Just
Yeah.
having Dan too often.
Yeah. No, all good. Yeah, enjoy your night. Thank you so much for having me. Yeah, we'll tee something else up sometime, okay?
For sure.
Beautiful. Maybe with Henry.